And as we approach both flu and holiday seasons, local hospitals are worried about what the future holds for healthcare systems that are already feeling pressure from COVID-19. NBC 26's Kelsey Dickinson has more on what they're experiencing right now.
As area hospitals continue to see high volumes of COVID-19 patients.
Right now, our healthcare systems are stressed to the most they can possibly accommodate.
Officials say the increased number of positive COVID-19 tests is leading to more hospitalizations.
The patients that we're seeing are extremely sick and they're requiring high levels of service. We've got people that have been impacted from birth to the elderly age, and we've got healthcare workers who are working day and night to try to take care of the community.
Bellin Health has been operating under the orange level of their surge plan for several weeks.
It takes the resources of primarily one of our units in our hospital, pretty much dedicated to COVID. And then it also takes up some of our ICU capacity.
Elsewhere, the chief clinical officer at Theta Care Regional Medical Center says the majority of hospitals in the Fox Valley region are 95% full with limited bed space available.
Really, hospitals are designed to operate at about 80-85% capacity, not 100% capacity all the time.
With the pandemic taxing resources both locally and statewide, officials are already planning for what upcoming holidays could bring.
As soon as you bring 8, 10, 12 people together, you do risk that case of someone may be asymptomatic and have it and then spread it to others, which then can propagate this pandemic or the surge even longer.
That's why medical professionals ask people to consider alternative options to in-person get-togethers this holiday season.
It may not impact you personally, but you don't know who you may impact in the community.
With flu season coming up as well, health officials say they're concerned how the addition of influenza patients could impact bed space and encourage people to get their flu vaccination sooner rather than later. Kelsey Dickinson, NBC 26.
As far as hospital space, there is what you might call a bit of a release valve for hospitals, as health officials say they evaluate on a daily basis if any coronavirus patients meet criteria to go to the excess hospital called the alternate care site near Milwaukee.